Hello, my name is Winston Bryant, and this is Vaccines, a stand to ensure the longevity of generations to come. During her 9th month of pregnancy, Mary Clayton Enderlin was exposed to whooping cough by an unvaccinated playmate of her oldest son, and although her symptoms were mild, she would soon realize the dangers of transmitting the disease to her newborn child. Just imagine watching your newborn battle a potentially fatal disease even before they can take their very first step. Despite the success of vaccines, according to reports from the Children's Hospital of Philadelphia, more than 3 million people die from vaccine preventable diseases each year, with approximately 1.5 million of these deaths being children less than 5 years old. Mary Clayton is one of many parents who have been impacted by the decline in vaccinations. Stories like Mary Clayton's are becoming far too common in modern day society and have forced us to address the long been subject of various ethical controversies that relate to vaccine regulation, development, and use generally revolved around mandates as defined by the National Vaccine Program. How many more innocent lives must be taken or put at stake before we determine that all vaccines and immunizations must be mandated and affordable? Today, I want to discuss this very issue that is of great importance to me and to you, my audience, as you prepare to start, if you have not already, your own families. I am a future pharmacist that understands the benefits and costs of vaccines and the impact they have on the overall health of not only an individual, but to the community as well. I was moved by Mary Clayton's testimony, and like many others, I was motivated to do something about it. The issues of vaccinations is not limited to the United States and has been an ongoing issue, more specifically in third world countries. However, there are several solutions that address this issue and ensure the longevity of generations to come. There are various ways in which we can stop the spread of vaccine preventable diseases, but the most important and essential initiative that can be taken is by you, the audience, by vaccinating your kids and encouraging family members and friends to do the same. Foremost, as concerned citizens, you must know the importance of vaccines, but also understand why having the choice to vaccinate is detrimental. Vaccinations benefit not only the individual, but the community as well. Early childhood vaccinations are put in place to protect children from diseases such as measles and chickenpox that, thanks to vaccines, have become extremely rare in the U.S., according to the CDC. When community vaccinations rates drop below the threshold of the original overall community, we run the risk of widespread disease outbreaks, such as the one that occurred in Japan in 1979. In 1979, when rumors spread that whooping cough vaccinations were no longer needed and unsafe, Japan suffered a major whooping cough epidemic with more than 13,000 cases of whooping cough and 41 deaths. As you can see, stopping vaccinations is not the answer. Having addressed the problem, that is, allowing vaccinations to be a choice of the individual, I will now turn to a potential solution to the problem. The Global Vaccine Action Plan is an often discussed approach by such organizations such as the World Health Organization, which states that we provide mandated global coverage for at least 90% of all vaccines nationally and 80% worldwide. There are clear benefits to this approach. Just 2 combination vaccines can protect children from 4 common diseases such as measles, who in 2013 was responsible for an estimated 218,000 deaths worldwide. Health systems will be forced to strengthen, building the capacity of frontline healthcare workers, improving monitoring, surveillance, and the delivery of adequate services. Lastly, simple community-based health education programs can be established. While I actually support the initiative to provide the mandated coverage for all, both nationally and internationally, I do not think, due to several challenges, that it can initiate immediate change. Inaccurate predicting and management of vaccine stocks can mean the supply of vaccines that may not always be available. Furthermore, despite discounted prices, the cost of vaccines can still pose a barrier to coverage. I have now outlined a popular solution for mandating vaccinations, and I have told you why. Though I support the measure, I do not think it is the best way to approach this problem. Next, I will turn to my preferred solution. There should be a focus on how we, as participating citizens, can implement change on a state level in a 2-tier approach. These 2 tiers are ending broad vaccination exemptions and prohibiting or limiting unvaccinated children from attending school. Starting with ending broad vaccination exemptions, I will discuss the negative impacts these exemptions have. Due to exemptions, states such as California experienced a measles outbreak in 2014 in no other than Disneyland Amusement Park, according to reports from the California Department of Public Health. By ending broad vaccination, you decrease the choice of widespread vaccine preventable diseases. In addition to ending broad vaccination exemptions, the second tier of the solution is prohibiting unvaccinated children from attending school. This can be limited to prohibiting unvaccinated students from attending school during an outbreak. In New York City, schools are allowed to ban students who are not vaccinated from attending schools where there is an outbreak of vaccine preventable diseases. This provides a means to put a populated community, such as a school, at risk of coming in contact with a vaccine preventable disease. If you are led to join in this cause with me and spread social awareness, here are 2 ways to get started. Held each year in August as a National Immunization Awareness Month is a campaign that highlights the importance of vaccination for people of all ages. You can access the American Academy of Pediatrics social media account to gain more information. Lastly, if you want to, the CDC website has provided toolkits that assist you in communicating to healthcare professionals, parents, and patients about immunization during August and throughout the year. I have explained what I believe to be the most viable and immediate solution to the problem of mandated vaccinations, and so I now turn to my conclusion. In my speech today, I have argued that we should end broad vaccination exemptions and prohibit or limit the unvaccinated children from attending school. As I explained, doing so will address the problem of mandated vaccinations more effectively than on focusing our energy in global immunization. We can make a big difference in the lives of our own communities and the lives to come.